Women with PCOS have abnormalities in the metabolism of androgen and estrogen. Now, I'm sure you're wondering what androgen and estrogen are. These are hormones that are usually released in the body. They are meant to regulate sexual development and many other features. For the women, they have more of estrogen, while for the men, they have more of androgen. So when a woman has abnormalities in the metabolism of these hormones, it becomes a problem. And at that point, she begins to have a high tendency of having PCOS, that is Polycystic Ovarian syndrome. The major features of PCOS include menstrual irregularities. That means you can see your period this month and the next month you won't see it. The second is an ovulation. That means you have irregular ovulation. It's either you don't have ovulations at all or you have ovulations but not all the time. And then the third is signs of hyperandrogenism. That means you begin to have some features like a man, like you have facial hairs, like having beards, having some physical features of a man. Other signs include obesity, when you are overweight, and also sleep apnea, when you find it difficult to breathe when you are asleep. Other signs include diabetes and also infertility, particularly in married women. There are people that have a high tendency of having PCOS. This includes people that have a family history of several women that have this particular condition, and also people that are being overweight, that's people that are obese, and people that have diabetes. These people are more likely to have PCOS. But these signs are not enough to say someone has PCOS. There are some lab tests and some imaging tests that will have to be carried out to be sure that that particular person has PCOS. Some of these tests include the thyroid function test, the serum prolactin level test, insulin level test, lipid panel test, and other tests. An ovarian ultrasonography can also be carried out with a pelvic CT scan. Now, lifestyle modification is considered the first line of treatment of PCOS. And when I say lifestyle modification, I mean like weight loss. If you are being overweight, you have to lose weight. And you can only do that by modifying your diet, eating food with low carbohydrates, eating food with high fiber content, eating more fruits, and many other things that will help you not to add more weight. And secondly, you can engage yourself in different exercises that will help you to lose that weight. That's the lifestyle modification. And then for the pharmacotherapy, that is the use of drugs to treat this PCOS, the first line is the use of oral contraceptives like medroxyprogesterone and ethinyl estradiol. This will be able to help to induce regular menses. And then if other symptoms like excess facial hairs are still there, then the use of some androgen blocking agents like leuprolide and finasteride can be used. Other drugs that can be used include some selective estrogen receptors like clomiphene. But please do not go to the pharmacy and ask for any of these drugs if you have PCOS. Go to the hospital. This test will be carried out, both the lab test and some imaging test, and then your physician will be able to say if you really have PCOS and the best drug or the best method that can be used to treat that. Thank you for watching my video. If you like this video, please share to someone out there, and don't forget to follow my page for more pharmaceutical care and healthcare tips. See you next time.